Dr. Jeff talks love, Dr. Jeff talks life, answers your questions, cuts through the strife. Sex and intimacy, real and true, evidence-based, made just for you.
Hello, welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we have honest, evidence-based conversations to help you build healthier relationships, deeper your intimacy, and have a more fulfilling sexual life. I'm Dr. Jeff Albaugh, your host, and whether you're joining us for the first time or if you've been with us from the beginning, I'm grateful that you are here. So thank you for being here. This is episode 79, Erotic Connection in Real Life. Love, Desire, and Long-Term Intimacy. Episode 79, that's crazy. So whether you're watching live or listening to the recording later, I just want to take a moment to really thank you for your time. Your time is precious, and I appreciate that you are spending some of it with me to learn more about this topic. Well, we are connected. We are across so many platforms. We're on Facebook, we're on YouTube, we're on X, we're on LinkedIn. A quick favor, if you are a Facebook person, follow us. The more people that follow us, the more we can do on Facebook. So please follow us if you're a Facebook person. Visit the website. On the website, you can go to all the incredible previous episodes, and there are 78 of them. Now there'll be 79. So go to those previous episodes, see what's interesting, and pull them up and watch them. You can also look at the calendar, see all the amazing things that are coming up through October. Visit the website. We appreciate that. You can take us along with you wherever you're going, we're going. So we're streaming with you. We're on Spotify. We're on iHeartMusic. We're on Amazon Music. We're on iHeartRadio. Wherever you are, you can take us with you. If you're working out, work out to Dr. Jeff. If you are on the road, wow, your loved one, and you can listen to an episode and enhance your relationship. So take us with you. We're where you are. As always, I'd like to take a moment to just say that all are welcome here. Whatever your sexual orientation, whatever your gender identity, your relationship style, this space was created for you. So thank you. I'm so glad you're here. The mission of the podcast is really simple. It's to empower and enlighten you with the evidence-based, that's the scientific-based information that improves your sexual health, that deepens your loving relationships so you can live your one miraculous, wholehearted life with more love. Who doesn't want more love? Today's episode is a little different than originally planned. This is the thing about live episodes. I was scheduled to be joined by a special guest, but sometimes life has other plans. Rather than postponing this important conversation, I decided to spend this time together talking with you about a topic that comes up almost every day in my clinic, in the clinical practice. And it's about how we keep desire alive in our relationships. Great topic. One of the biggest misconceptions about desire is that if the spark fades, something must be wrong with that relationship. The truth is that desire isn't something that we either have or we lose forever. It's something we nurture. Like trust, friendship, and emotional intimacy, desire requires attention, curiosity, and intention, purpose and intention. Over my 30 years specializing in sexual health, I've worked with thousands of individuals and couples who worried that they had somehow failed because their sex life didn't look like it did at the beginning of their relationship. Well, most people's don't look the same as they did at the beginning of their relationship. The reality is that relationships evolve. Our bodies change. Stress, careers, parenting, caregiving, illness, medications, aging, all these things can influence our desire. None of those changes mean that intimacy has to disappear. It doesn't. Today, we're going to explore why desire changes, some of the science behind spontaneous responsive desire, common myths that create unnecessary shame, and practical evidence-based ways to reconnect with your partner. So, before we go any further, let's begin. I'm going to pull up my presentation and we're going to jump right in with erotic connection in real life. How do you keep that erotic connection alive? That has to do with love and desire, and also how do you do that in a long-term relationship? Well, that's what we're going to unpack today. So, first off, I'd just like to remind you, as we do so often here, this is not about performance. When you come into that intimate space, you want to be authentic and fully present. It's not about performance. It's about connection. Connection. Being fully present and authentically there with your partner. So, not about performance, presence over performance. Did you know that lack of desire is the most common sexual complaint if we group men and women together ages 18 to 59? So that's 1 in 6 men and 1 in 3 women complain of a lack of desire or a diminished desire. So today our goal is to normalize that conversation about how desire exists in a relationship, so that you can talk about this at home and think about how desire is in your relationship, and know that the more we talk about it, the more openly we talk about sexuality, the more comfortable that those conversations become. And guess what? Talking openly about sexuality is itself an act of intimacy. So you're off to a great start just talking about it, which is pretty cool if you think about it. So that's kind of our goal today, is to normalize the conversation about desire so couples can actually have it at home, have that desire conversation at home, and know that they are not an enigma, not unusual, not something so strange, but that desire does change and evolve over time in long-term relationships. So let's go through a little bit about the reality of long-term desire. We've already said, guess what? Desire changes. That's normal. It's normal for desire to change over time. You are not a failure. It is normal that desire will change. New relationship energy, NRE, new relationship energy. If you haven't heard that term, it's an important one. It's so cool. It's neurochemically driven. Things like dopamine, neuroepinephrine, and PEA, all these neurotransmitters are really important. So these neurochemicals are in your brain, and new relationship energy exists because of those things. NRE typically peaks in about 6 to 24 months. Then it naturally stabilizes. So it increases, it peaks, and then it stabilizes. So the shift from passionate love, that, oh my gosh, I'm so into you, I can't think of anything else, I can't possibly exist anywhere beyond what's happening between you and I, that really passionate love and that driven passion turns into compassionate love, which is this is a biological expectation, because that NRE is going to settle. It's going to naturally stabilize, and then we turn things from passionate love into compassionate love. This transition is not the end of your erotic connection with your partner. It's actually the beginning, just the beginning of chosen intimacy, the choice to stay together, the choice every day to love in this incredible way. Love is an action. It's a choice. And that's what this is all about. So we move out of that beginning, neurochemical dopaminergic feeling of, oh my gosh, new relationship energy, got to be together, got to think about each other constantly, to compassionate, chosen love. So what typically erodes desire. When we think about things that affect, so in our daily lives, desire fluctuates. Sometimes we don't have desire, and there's many, many reasons why. Some of the common reasons are we're stressed out. We're stressed out, and that raises our cortisol levels, and cortisol levels decrease testosterone and libido. So when we're stressed, and we're stressed a lot, it impacts desire. Parenting demands often, and a shift in your identity because of the role as a parent, or the role as a caregiver, or the role as whatever shifted in your roles, can greatly affect your desire with your partner. If you've become more of a caregiver to your partner, that may affect your desire towards them. When you feel like you're parenting all day, how do you shift into, my patients talk about all the time, how do I shift over to the sexy mom or the sexy dad when all day long I've been dealing with kids issues and dirty diapers and all kinds of things, or shift out of work mode and the stress of that into love mode and sex mode and those kinds of things. So different roles, and especially things like parenting and caregiving, those things can impact desire. Then our health changes, and as we move through our life, we're going to have health issues and hormone shifts that occur with some of those health issues, but occur naturally sometimes too. Certainly chronic illness, and you think about all the people with chronic pain. I have so many patients with chronic pain issues. I have many patients. You think about the most common diseases that we have are chronic, like hyperlipidemia, that's high cholesterol, coronary artery disease, that's, changes in blood flow in the arteries throughout the body that causes blood flow changes, diabetes. So many people have these chronic diseases, and all of them can impact blood flow, hormones, nervous conduction, sexual function. Because remember, sexual function is about blood flow and nervous conduction and hormones, and all those things can be affected by some of these illnesses, these chronic diseases. Medications can affect it too. So many, many things that may be going on in your life might be affecting your desire. Then, of course, emotional disconnection and unresolved conflict. When my patients talk about all this time, my partner wants to have sex, but I'm still upset with them, and I can't get past that. We'll talk a little bit more about that in a few minutes. But some people they can't move past that emotional disconnection and distancing that occurs from unresolved conflict in the relationship. Then two things get rogue and routine and predictable, and we don't have novelty, which increases dopamine too. So those neurochemicals are super important. And sometimes when we get in this pattern of constant whatever, we lose some of the excitement that comes with the novelty and the mystery and curiosity of what might be in terms of intimacy and sex. Body image concerns. I know as I get older, you're always like, oh my gosh, clothes cover all kinds of things up. And as we get older, it's more difficult to keep everything up where it belongs and keep ourselves really healthy. But our body changes and it shifts. And I know as I've aged, hairs are growing places they're not supposed to grow, your ears and your back. And I have all kinds of complaints from my patients and my friends and myself. I'm like, why do I grow hair on my shoulder now? How weird, And it's like, or my ears, really? I mean, it's like, it's just bodies change, and your image of yourself changes greatly with that. So, and there's certainly age-related things, and so many people are self-conscious about their bodies. Sometimes it's like, oh, don't turn on the lights when we're having sex. My patients will tell me, don't turn on the light. I don't like the lights on. Or I don't want to be totally naked because I don't like my body. Well, that can be challenging. We need to learn to love the body we're in and accept it, but it can be difficult because our body changes. And sometimes we feel like, I feel like sometimes this is not pretty. These saggy love handles are not pretty. So I get it, and I hear it all the time, but body image changes are a big deal. And just fatigue, we're tired, we're so busy. We're physically and emotionally fatigued, and that can really take a toll on us when it comes to desire and sex. We like to think we can do it all. We can work, we can take care of the kids, we can take care of our parents, we can take care of ourselves, and we can be sexual and all those things. But it's hard to fit it all in and get it all done and make it all happen and feel like you want it to happen. Sometimes you get to the end of the day, and I don't know about you, but I'm like, I can't even think anymore, much less anything else. Or I lay down, and before my head even hits the pillow, I feel like I fall asleep. As you get older, you have things like mouth guards because you grind your teeth like I do, and maybe too much information. But bottom line is, what happens is I'll fall asleep before I get a chance to go to the bathroom and put my mouth guard in. My patients tell me the same things. It's like sometimes I'm asleep before I can get my CPAP out or whatever is going on. So fatigue is a big deal. This is a really cool model, and it's thought to be one of the most useful models that has been discovered in research, and it's called the dual control model of sexual response. And I think if you understand this in terms of your sexual accelerators, what turns you on and makes you have more desire, and what breaks or decreases desire, you'll understand a little better what's going on. It was developed really by Bancroft and Jansen at the Kinsey Institute. And at the end, I have the references for all this if you want to see the science behind it. I love this model because it helps you understand what is going on with your desire. So sexual excitement system, SESS, the sexual excitement system responds to sexually relevant cues. And that's your accelerator. You're kissing, you're hugging, you're touching, you're petting, you're seeing things that turn you on, you're thinking things that turn you on, you're reading erotica, whatever's happening that is accelerating or exciting you. And then there's your sexual inhibitory. This is your brake system. So we have the accelerator system, now the brake system. The sexual inhibitory system responds to perceived threats or distractions. And that's the brakes. So you're in the middle of sex and one of the kids is pounding on the door, and that puts the brakes on, right? So that is a inhibitor, part of the inhibitory system, and that's your brake system. So believe it or not, we have these accelerators and we have these inhibitors. So we have the excitement and the inhibitors, and excitement is our accelerator, like the gas we push when we want to go faster and when we feel more desire, and the brakes kind of put a hold on everything. But believe it or not, most desire problems in long-term relationships are not because of a broken accelerator, because I don't get excited when I hear erotic things or when I'm kissing or touching or being with you. It has more to do with an overactive brake system. I have a lot of stress in my life. I have a lot of other things going on that are getting in the way of sexual thoughts and sexual and intimacy with my partner. So what are common brakes? What puts the brakes on it? Well, stress. We said that for sure. Body image. Remember we talked about that? How I think about myself. It's like if I don't think of myself as sexy or something's not working quite right, so I'm worried about it not working right, like my erection's not being there or something like that, that's going to be a brake. When it's going to put a brake on your desire, because the thing is you have less desire because you're worried about, but then I always have trouble keeping those erections during sex or whatever. Or I don't lubricate right. Many women complain of that. Those are the two most common complaints besides desire. With men, it's erectile dysfunction, difficulty getting and keeping erections. With women, it's vaginal dryness and discomfort during sex because of that. So so those are some of the body changes. But in addition, relationship tension. You're not getting along. Some people can have sex when they're not getting along, but many people cannot. They don't feel emotionally connected and emotionally engaged. We're distracted with a million different things. We don't have time or energy for sex. And then also performance anxiety. I've struggled with this in the past. Now I'm worried about it in the present situation right now. So Emily Nagoski, who wrote the book Come As You Are, and she is an amazing researcher in sexual health. She says the question is not why don't I want sex? Why don't I want sex? But what is stepping on my brake? So what's stepping on my brake for sex? What's putting the brakes on for you? Well, it's like, gosh, I didn't used to have this gut. That kind of is putting the brakes on it. What is it for you? Wow, I have so many things on my plate. What's putting the brakes on? Oh, well, society says sex has to be intercourse, and I'm not comfortable with that. Who says sex has to be intercourse? There's plenty of other things to do, but that puts brakes on it. What puts the brakes on for you? That's the real question. So, when I think everyone out there understands spontaneous desire, that drive. You may think of words like "I'm horny" or you really want sex, or you have this really strong drive towards sex, which is sort of often thought of as a hormonal sex drive. That's why we call it a drive. But that's spontaneous desire. But most adults in long-term relationships, believe it or not, in those long-term relationships experiences, responsive desire is more common. What they usually have is more responsive desire than spontaneous desire. That's normal. It's clinically normal. The research says you are normal. And what I'm telling you is if you don't have that, oh my gosh, I'm always horny, I always want sex out, that is very normal. Responsive desire is the norm, especially in long-term relationships. So you're just know that there's nothing wrong with you, that responsive desire is the way that it usually goes during sexual arousal. So what's spontaneous desire? That's, again, it arises without context or stimulation. It's more commonly early in the relationship. It's more common in men. So that's that drive. Oh, I just feel such a need for sex. Some people have it. And especially when we're younger, we have it more often, and men have it more often than women. These are generalizations, but they're research facts. Responsive desire emerges in response to stimulation, to context, connection and context, to emotional connection. Rosemary Bassan did some wonderful research that looked at this, and study after study has shown that responsive desire is often the norm. Responsive desire is not lower or broken than spontaneous desire. It's just as important. It simply requires a conducive context. It just requires connection. It just requires stimulation. It doesn't just come out of nowhere like spontaneous desire can come. Hope that makes sense. All right, responsive desire is a really important concept to understand, because if you're like most people, you're saying to yourself, I don't have that guttural spontaneous desire. But when things get going, I really do have some excitement and desire and want to get involved. Or sometimes as we move along and we feel deeply connected, we come around to, yes, I am starting to feel some desire. So partners who understand this concept stop waiting for desire just to happen spontaneously. Oh, it's just going to happen. It always happens. And they begin creating conditions where it happens. And that's why it's so important in a long-term relationship to understand responsive desire. Create those situations where it can easily happen. And that can be a lot of fun. So responsive desire, really, really important concept. I want to talk just a little bit next about emotional safety. And emotional safety is the foundation of erotic desire. You cannot be erotically present when you do not feel safe, period. I see a lot of patients who've had past traumas, whether it's sexual trauma or other traumas, and that makes them feel unsafe, even in situations that they may or should feel safe. Safety is an essential foundation. Emotional safety is an essential foundation to erotic desire. So psychological safety is simply a prerequisite for me to feel sexually vulnerable, for you to feel sexually vulnerable. It has to be present. So unresolved things, and this is what I was talking about before, when there's unresolved resentment, when there's unresolved contempt, that's personal upset with the other person or criticism, these things activate the nervous system and it creates a threat response, which is sort of that cortisol anxiety response. So this is what the science tells us, that unresolved resentment, conflict, contempt, criticism, all these things can lead to the nervous system feeling threatened and a raise in anxiety and cortisol, stress. So a regulated nervous system, the parasympathetic state, is required. So that's what we need for sexual arousal and for pleasure. So we don't want to feel stressed. We don't want to feel threatened. So safety is an absolute prerequisite. Sometimes the low desire is due to an attachment injury. And those attachment injuries are with your partner where you have unresolved emotional trauma. You're upset with each other. And I know for some people out there, I'm not saying everybody gets this. Some people might like, you can still have sex. Yes, you can. But intimacy requires deep connection on all levels. And people cannot connect intimately when they have unresolved emotional conflict and trauma. So you got to work on those issues. You got to work them out. And everything doesn't have to be perfect, but everybody has to feel safe so that they can be vulnerable. How can I show up authentically when I don't trust you now because we have unresolved issues and unresolved conflict? Really important to understand. So, communication as an erotic practice. The most intimate organ in your body is your brain. So engage it. It's the largest, most important, intimate organ in your body, and that is your brain. So research consistently shows us that sexual communication is one of the strongest predictors of sexual satisfaction. So learning to talk about sex is essential. And we've talked about this over and over in the podcast, and I mentioned it early. So I'm not going to beat a dead horse, but learning to talk about sex, not in the heat of the moment, but lovingly to discuss, I really enjoy when we do this. What do you think about this? Communicating around sex. It's important for sexual satisfaction. All right. So what are some effective communication strategies? What should you do? First of all, you want to express desires without shame or demand. Remove the shame and blame, remove the demand, but just talk about I need, I desire. What are those desires? Giving real-time feedback. That means verbal and nonverbal feedback. When we're communicating back and forth, we have to volley back and forth with that communication. That means you need to acknowledge what I've said and make sure you understood it before you comment and say what you have to say. But giving real-time feedback is important. Discuss what exactly is going on, what's working, what isn't working, and don't do it in the bedroom necessarily. You can, but not during sex. Some people like to do what we call pillow talk and lay and talk about things, not right after, not before, not right during sex, but maybe another time where you're just having a really good intimate conversation about what works, what's not working, what we can do better, how we can have more fun. That's what it's all about. Asking curious questions. What does pleasure feel like to you right now? What does pleasure feel like for you? What do you want? Asking those curious questions. These are effective ways to communicate around intimacy and sex. And then we want to avoid we want to avoid accumulated distance. So we're already having problems. We don't really work on our issues and we just let them fester. You know what I'm talking about. We just let the issues, they're ongoing issues that just never get resolved. And tend to fester and not do so well. So we need to work on those, because we're not going to have good sexual conversations or good sex when we aren't connected because of unresolved conflict. All right. So also another really key, very important thing is the role of novelty. Novelty, new things, and also curiosity. Love that word. You know, I've said that before, but the brain is wired to respond to new. So use that. Do some new fun things. Don't fall into the same patterns all the time, but mix it up a little and make it fun. The brains, and these are those neurochemicals again, like dopamine. And so the brain's dopaminergic reward system, it's activated by novelty, by new things, by anticipation. Sometimes just so you think, oh gosh, if we schedule sex, but sometimes we have the anticipation leading up to today's the day. We're gonna actually make time for pleasure and play and fun together. That's anticipation, and that's savoring. Savoring has been shown in research, happiness research. Savoring is a big deal. So anticipating and savoring, thinking about the sex you had afterwards, makes you happy too. So happiness research shows that savoring is a big deal. That's the savoring beforehand, thinking about and anticipating things, and then afterwards savoring those beautiful memories of sex. So the novelty, the anticipation, the exploration of each other. Explore new things. I'm gonna blindfold you and then kiss you different places, and you tell me what feels good, and just exploring things. So lots of different ways that you can do that. All right. In long-term relationship, novelty, it doesn't require new partners at all. It requires new experiences, contexts, or perspectives. So just new experiences, new fun things, new context, maybe a different situation. Maybe you're away on. I was just talking to a couple who said, when we're on vacation, we don't really have sex. I'm like, why? You're in a hotel, you're in a different space, you're in a different place. It's exciting. I don't know. Or they're like, we're in someone else's house. Well, you don't have to necessarily expose yourself in someone else's house, but it can be really fun to be in a new context or a new place. So new context or just a new perspective on things. Mix it up a little bit. And so what does the research shows helps? Well, it shows that new environments or settings, that's what I was just talking about. Maybe you always have sex in the bedroom. Maybe go in the guest bedroom. Maybe go in the bathroom. Maybe go in the kitchen. Maybe go in the family room. Mix it up. It can be very exciting. Try mutually agreed upon new activities. Try new, fun, different things. Pull out the feather, pull out different textures, put a tarp on the bed and get different dessert sauces and try different sauces on different parts of the body and see what you think. Lots of things you can do. Revisiting early relationship rituals with fresh attention. Remember when we used to? Let's try that again. Yeah, of course you want to be careful, but new places, new things can be really, really exciting. So just approaching your partner with genuine curiosity. So realize that people change over time. What's different about your partner? What's new? What's exciting? Do you know who they are right now, right here, right now? Have you been paying attention? That turning towards the Gottman research shows is so important. Are you still curious about your partner? Really important. So we've had several episodes, and we have another one coming up we have another panel on playfulness. Play is a really important thing, but playfulness, humor, and erotic energy is super important. Desire doesn't always have to be serious. It really doesn't. It can be lots of fun. Play is neurobiologically appropriate and important. It reduces threat. It increases oxytocin, which is sort of a connecting neurochemical, and it opens the nervous system. So that's a neurobiologic state occurs when you play. So play together. Couples who laugh together regularly report higher sexual satisfaction. So playful communication is things like, I am safe with you. I don't need to Playfulness communication. I'm safe with you. I don't need to perform with you, but maybe sometimes it is. Maybe I'm going to put on a little costume and perform with you. Let's have fun together. But you get in a space where you're like, it's not about performance, it's about pleasure. So we can have fun, we can play together. Erotic energy can live in appropriate teasing, not inappropriate teasing, but appropriate teasing, inside jokes. It's like only you two know this specific thing. When you look at each other and you're like, oh my gosh, that brings to mind something only you know, which can be a really cool thing. Physical play, playing physically together, tickling, cuddling, lighthearted flirtation. When was the last time you grabbed your partner's butt? Or you came up behind and kissed him on the back of the neck? Flirtation, what would be meaningful for your partner? So think about those things, and how can you add play into your love play and your sexual repertoire? We want to be intentional about our connection. I know we think everything will just happen, but we move from passive to active. Desire in long-term relationships is a practice. It's not a passive experience. We have to work at it. So when we look at the research, that's when I say clinically, I mean research shows that couples who sustain erotic connection treat intimacy as intentional, not incidental. Not it happens accidentally, but I'm making sure it happens. I want it to happen. Everybody wants to be desired and wanted. The Gottman Institute's research shows that emotional bids, that's positive bids towards each other and turning towards your partner. When they say something, are you listening? Do you put your phone down? Do you turn towards them? Do you interact with them with curiosity and love? What happens to your face when they walk into the room? These are positive emotional bids and turning towards. And these are really important in long-term relationships, according to the Gottman Institute research. So intentional practice can include scheduling intimacy. I know you think, oh, it shouldn't be scheduled. And we've talked about this a couple times, but scheduling it makes sure it happens. We are going to shoot for Wednesday and see what happens. You don't have to say the exact time. Maybe you do, but scheduling it makes it happen. It destigmatizes this. It creates anticipation and not pressure. So schedule it into your week. Put it in your phone. Put it on your calendar. Regular state of the relationship check-ins. How are we doing? Really can be very important. Check in with each other. Non-sexual physical affection. Dopamine is raised with a 15 to 20 second hug. Prolonged eye gazing, where you look into each other's eyes for 30 seconds or so, will also increase dopamine. Doing new things, touching, proximity, all these things increase neurochemicals that make you want to be together and more intimate and sexual. And then really just taking the performance outcomes out of it and making it about just being together and being in the moment. So important. And so how do we address this? What if one partner has a huge desire and the other partner's like, I have no desire? That's called a desire discrepancy, and it happens in almost all relationships. So first off, it's a clinical reality. That means research shows most couples have desire discrepancy. One person has more desire, one person has less. This is a really important concept for you to understand. Desire discrepancy is present in the majority of long-term relationships. Almost everybody has a desire discrepancy. And so it's normal. It's not the exception. So don't think that you are weird or different. It is completely normal to have desire discrepancy between partners in a long-term relationship. Neither partner's level is correct while the other one is incorrect. Absolutely not. Both of them are what they are. The higher desire partner often feels rejected because they have this high desire and they often feel like they're dejected or rejected. And the low desire person often feels pressured, and they both suffer. So both people are suffering. Neither is right or wrong, having a low or a high desire, but both people often suffer when there's this desire discrepancy. And so working on that together, negotiating what works for you as a couple with that desire discrepancy can be really important. And then you can always work with trained professionals. And I put You can find a provider through the ASEC website and pushing on the Find a Provider tab, and you will find someone to help you with some of those issues. But mostly it's talking about it, learning to talk about it, and learning to work on it together as a couple. So we've unpacked so much stuff today, but mostly I think what's important is that desire in long-term relationship is a shift from spontaneous desire to responsive desire. It's expected, it's normal. Responsive desire is where you feel more connected. It has to have context, it has to have stimulation. It doesn't just happen out of nowhere, but it's normal in long-term relationships. Emotional safety, communication, and novelty are the three really important factors. Emotional safety, communication, and novelty are three of the most important things I want to pull out for you that sustain erotic connection. So if you don't remember anything, those three things are super important. Playfulness and non-sexual affection maintain that erotic atmosphere between intimate encounters. So kissing, hugging, all that affection is really important to that erotic encounter too. Foreplay, it doesn't just start a few minutes before or when you get into bed. It starts really about 24 hours beforehand. That's when foreplay really begins. That's important to remember because how you treat each other and how you're interacting each other within that 24 hours or 48 hours before makes a big difference in your erotic and your desirable connection together and during those encounters. So intentional, proactive investments, planning that connection predicts long-term sexual and relationship satisfaction. So making sure you're infusing your relationship with intimacy and sex, it's not going to happen unless you put it in there intentionally. Desire is in real life it's not a mystery. It's not like, oh my gosh, how does desire happen? How does it come out of nowhere? It's a set of learnable, practicable skills. It doesn't just come out of nowhere. They are learnable, practicable skills, and we've unpacked some of those today. So couples who sustain intimacy are the ones who stay curious about each other. And curiosity is so, so important. Lots of things to think about, but I hope it helps you move to a better place with your relationship. And so I would like to move into our centering exercise as we finish out those all that information, and that was a lot. But as we go into that, as we do during this time, I would like to bring you to this little bit different place before we end today's episode. I'd like to, just as we do, invite you into a brief reflection. If you're able, sit comfortably and allow your shoulders to soften. Let your hands rest gently in your lap. Take a slow, deep breath in your nose and gently exhale through your mouth. Again, breathe in deeply and slowly let it go. Keep that breathing pattern. Inhale through your nose and exhale through your mouth. As you breathe, imagine a small candle burning inside your heart. Small candle burning in your heart. It's a steady, not a large or dramatic, but a warm, constant, and alive flame. The flame represents your capacity for connection, for affection, pleasure, and love. There may have been times when life's challenges made that flame feel smaller, but it never disappeared. It has simply been waiting for your attention. Just waiting for your attention. And as you breathe, silently repeat, I welcome curiosity instead of judgment. I welcome curiosity instead of judgment. I am worthy of giving and receiving love. I am worthy of giving and receiving love. Desire grows where kindness, presence, and intention are nurtured. Desire grows where kindness, patience, and intention are nurtured. Think of one small act of connection you could offer this week. Perhaps it's holding your partner's hand a little longer, sharing an uninterrupted conversation, silencing your phone and putting it aside, an uninterrupted conversation. Time is the greatest gift you can give others. Offering a genuine compliment, something you genuinely feel, planning time together, or simply saying, I am so grateful for you. What is one small act of connection you can offer this week? Remember that lasting intimacy isn't built through grand gestures. It's not built through grand gestures. It's built through small moments of turning towards one another again and again. Every day, every hour, you have a chance to turn towards those you love. Take one final deep breath in and exhale slowly. Carry that warmth with you into the rest of your day. Well, Vic, what's up next week on Dr. Jeff Talks About Sex and Intimacy?
Can a single intimate moment change the way you interact with your partner for days? In this episode, Dr. Jeff is joined by world-renowned female sexual medicine expert, Dr. Susan Kellogg-Spat, in a panel of specialists to explore the afterglow effect. They dive into how sexual activity predicts an increase in positive emotions and affection the following day. Join us July 14th at 7 p.m. for an honest discussion on using intimacy as a tool to build trust, reduce conflict, and foster a lasting culture of goodwill in your relationship.
Well, thank you for spending this time with me. Thank you so much. If today's conversation resonated with you, please share this episode with someone you care about. Together, you and I together, we can continue creating healthier relationships, stronger intimacy, and more compassionate conversations about sexual health. Until the next time, be kind to yourself. What greater gift could you give? Be kind to yourself. Be present with those that you love. And remember that intimacy begins with connection, deep connection. Who doesn't want more of that? Goodbye.
Dr. Jeff talks about sex